Hi there, and thanks for joining me. I'm Corey Mabry, Director of IAC MRI Accreditation. In this webcast, we focus on the common oversights that are encountered with IAC MRI accreditation and how to avoid them. Here are the most common categories of oversights, and they're listed in order of frequency that are identified during the IAC MRI physician, physicist, and technologist peer review process that require additional documentation. First category is reporting. Second category is equipment documentation. And last but not least is image quality. Now, for the sake of keeping this webinar brief, I'm going to focus on these three common categories that additional documentation is sometimes required for. Please keep in mind that the oversights that are identified during the IAC peer review that require additional documentation are by no means confined to the items that I'll be reviewing in this webcast. Before I dive too much deeper, I'd just like to let you know that about half of the applications that are submitted for IAC MRI accreditation contain some type of discrepancies that are identified during that physician, physicist, and technologist peer review that must be rectified prior to the accreditation being granted. If your facility is asked to provide additional documentation once the application review process has been completed, know that you're not alone, and in most cases, it's not as bad as it may seem at first glance. Also, another thing to keep in mind is once the documentation that's been requested is submitted, it'll be reviewed within about 5 to 10 business days, and your facility will be notified of the outcome of that review at that time. Alrighty, the first item on the list of most common oversights is reporting deficiencies. Oversights identified during the IAC peer review related to reports account for the most common request for additional documentation. First thing I'm going to go over is the clinical indication, which must include but is certainly not limited to a brief description of the patient's symptoms, their duration, and any pertinent medical or surgical history. Common pitfalls include a header for this section with no text or inappropriate text. Some examples of inappropriate text for the indication include, but are certainly not limited to, a statement that indicates that the history is not available, a description of the area of interest without any other data, a description of the patient's age, and sometimes we get right knee pain for a left knee MRI. Next, the final signature date of the interpreting physician is not included. Now, this final signature date is similar to the date that you would place beside your signature when you sign a mortgage or maybe some other type of legal document, where you would essentially read over the document and then sign and date the bottom. For IAC MRI accreditation, both electronic and manual or handwritten signatures are acceptable. Please keep in mind, however, that electronic signatures must have an electronic signature date. And as you may have guessed, manual or handwritten signatures must have a manual or handwritten signature date. Now, some common oversights that are encountered include a blank after the header, or in the case of the manual or handwritten signatures, this item is sometimes missing altogether. For electronic signatures and electronic signature dates, keep in mind that the dates of dictation and transcription preceded by DD and DT respectively aren't sufficient. Also, electronic signature dates must also include a timestamp. The next item is when the reports are not signed within the 4 business day time frame. Sometimes we see the reports that are signed just a few days late. Other times they're not signed until a couple months later. Now, as you can imagine, if there's no date with that signature, there's no telling when it was signed. The next common oversight with the reports is when the reports of the contrast, the intravenous contrast enhanced exams, don't have the specific brand name and volume of IV contrast administered. Now, keep in mind that for the brand name, gadolinium and intravenous aren't acceptable. Many times, we see the volume of IV contrast administered omitted altogether, or in some cases, the molality in millimoles per kilogram is reported, but not the volume or the amount administered. The last reporting oversight that I'm going to go over is regarding interpretation discrepancies, which means that there was pathology that was present on the images that the IAC reviewer has determined was either not described or described incorrectly on the report. Now, this is where thorough proofreading by the interpreting physicians prior to signing off on the report and physician peer review come into play. Now, as I'm sure you probably guessed, there's a lot of potential reporting oversights that are maybe present on each report. And you may be asking yourself, how in the world can I remember the items that we need to assess on the reports? Also, once I've done these assessments, how can I record them? Now, the answer to these questions is easy. Use the IAC QI tool. Not only is it free to use, the questions there are the same questions that the IAC reviewers use. So if you use the QI tool, you've essentially turned the report submission into an open book quiz. More info on the IAC QI tool can be found on the website included on the bottom of this slide. The next most common oversights are related to the equipment documentation, specifically the operator quality control material and the PMs or annual QC surveys that are performed by the medical physicist. For the operator QC, this is to be performed on an ongoing basis. The assessments that are to be included are the assessments of the center frequency, relative signal to noise, image uniformity, and artifact. Now, many of the equipment vendors or the MRI unit manufacturers provide forms to record the results of these assessments. Some facilities even use an Excel spreadsheet. Either method is okay. The application will request the QC test results log sheet from 5 days of testing. Now, if you only do it 3 days a week, you'll have 3 days from 1 week and then 2 days from the next. Once the online application is submitted, you'll be asked to upload the case study images as well as the QC phantom images. The most common deficiency regarding operator QC is that the dates of the QC phantom images don't match the dates of the QC test results log sheet. And this happens because sometimes a couple weeks may have passed between the uploading of the QC test results log sheet and the request for images. So it's very important to check the dates of the QC test results log sheet to ensure that the dates present match the dates of the images that you're going to be uploading. Some facilities even go so far as to write down the dates present of the QC test results log sheet so that they have them handy when it comes time to upload the images. Now, for the submission of the PM or the annual physics QC, the most common oversights are the omission of the name of the engineer or physicist that's doing the assessments, the date of the report being too far in the past. Keep in mind that we require that the PMs or annual surveys are dated within a year of the submission of the app, or sometimes the report doesn't have the identifying characteristics that are necessary to confirm that the report is for the pertinent MRI unit, which must include the address of the unit, the manufacturer, and the serial number. Other common oversights regarding the PM annual surveys are the omission of follow-up maintenance records when the engineers or physicists identify a deficiency. An example of this, it happens pretty often that an engineer or physicist will come out and say in the report that a coil is broken or some aspect of the MRI unit is malfunctioning in some way. And in most cases, I feel pretty strongly that facilities have already had it repaired, but they just forget to turn in the repair record to accompany the PM or the annual physics QC survey. Now, more information regarding the PMs and annual QC surveys may be found on the IAC MRI websites indicated here. I strongly recommend sending the sample PM report and the brief, I think it's about 17 minutes long, webcast that's dedicated to the PMs and annual QC physics surveys to your engineer or your site medical physicist prior to their next visit so that you can ensure that the required assessments are included in the PM or annual QC physics survey reports. Now, the last thing that I want to go over, certainly not the least, is case study image quality. Now, while the guidance that I have here seems very simple and very straightforward, you may be surprised how often things go awry. Now, first off, since you have the opportunity to handpick the case studies, here's your chance to show off your facility's best work to IAC. To do so, carefully look at the images from that case study that you're thinking about submitting and determine if it's one of the best examples of your facility's imaging with that particular body part. If it's not, you can pick another case. You'd be surprised how often people skip this step and submit a case study with poor image quality. In some cases, we've even seen exams submitted that the facility's interpreting physician think are poor quality, as they'll reference the patient motion and any other artifacts as limitations in the report. Another common oversight is this submission of wrong or incorrect case study images. You may be asking yourself, how on earth could the wrong set of images be submitted? And it's actually fairly common for facilities to submit, for example, the images of the right wrist MRI when they uploaded a report for the patient's left wrist MRI. And a lot of times patients have both extremities scanned and both lateralities scanned in one day. Or another example that happens kind of often is the submission of her lumbar spine images when the report that's uploaded is from a cervical spine on the same day. Or even less common, some facilities mistakenly upload x-rays from the same examination date in place of their MRI images. Now, again, you may be asking yourself, how can I tell if the images that I'm preparing to submit are the best? The answer to this question is very straightforward. Use the IAC QI tool. Again, not only is this tool free to use, the questions that are here are the same questions that the IAC reviewers use. So again, if you use this tool, you're essentially turning the image submission into an open book quiz. More info on the IAC QI tool can be found on the IAC MRI website located on the bottom of this slide. And that concludes this webcast. Feel free to contact IAC with any questions. We look forward to hearing from you.